Am I disease-free? That is a question in the back of the mind of all breast cancer patients. Every year when they're coming in for their mammograms, or when they come in to see their breast surgeon or medical oncologist or radiation oncologist, always lurking in the back of the mind of the patient is the question, am I disease-free? What I'd like to do right now is sort of give you the surgeon's view of this, the surgeon's perspective, because most of us in the world of breast surgery are typically sort of focused on the local regional area, the breast, the lymph nodes, etc. Our medical oncologists colleagues are focused not only on the local region, but also the entire body. As I've shared before, once the cancer is invasive and the cells have grown out through the walls of the ducts and the cells have shed off and are circulating within the body, those cells are like throwing grass seed out the window, can set up shop potentially anywhere. And so therefore, for years, we monitor patients to see if their cancer would come back elsewhere in the body. And how that monitoring is done, or recommended to be done, the systemic recurrence, if you will, I'd like to defer that to one of my medical oncology colleagues. So am I disease-free when it comes to the breast or the lymph node area? Well, one of the things we look at every year are mammograms, or if that's not indicated, physical examination, obviously. Breast MRI is indicated particularly in patients who have a history of stage 3 breast cancer as a way of detecting any residual or recurrent disease back at the breast, the axillary region, or the mastectomy site. Now, the whole issue about being disease-free varies a lot with the original biology of the cancer. Cancers that are estrogen receptor positive can reoccur elsewhere in the body, or back in the breast for that matter, several years after the original diagnosis. Please remember that with lumpectomy or breast conservation, again, depending on the age of the patient, the nature of the cancer, the biology, the chance of the cancer coming back in the breast probably ranges anywhere from 0.4%, maybe up to 1%, or slightly over that per year. Even after a mastectomy, you could have a recurrence of the cancer. Most lifetime numbers are quoted around 3 or 4%. So the question then, am I disease-free, may never be able to be answered fully. Even in patients who have had a mastectomy for in situ breast cancer, as I've shared before, there's no breast surgeon on the planet that can say we've removed 1,000% of all breast tissue. So literally any microscopic tissue left behind theoretically could become cancer 10, 15, 20 years from now. So I know and understand that this question is always on the mind of the patient. Please understand the reason for the frequent visits, particularly during the first 5 years, is for us to look for potentially local or regional recurrence and certainly systemic recurrence. Again, as I said a minute ago, I'm going to let my medical oncologist focus on the monitoring for any potential systemic recurrence. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.